The Human Science Research Council, in partnership with the University of KwaZulu-Natal's Nelson Mandela School of Medicine, earlier this year conducted a study looking at the impact of COVID-19 on healthcare workers. The survey was conducted with the aim to ascertain the impact COVID-19 has on healthcare workers physically and emotionally. For now, we're joined on the line by Priscilla Reddy. She is from the Human Science Research Council. Priscilla Reddy, rather. Professor Reddy, thank you very much indeed for your time. So COVID-19, as we've been learning, and we're learning every day with regards to some of the lingering effects, people are complaining about mental health issues, depression, fear, the uncertainty, the confusion, etc., etc. What were some of your findings with regards to healthcare workers?
Good morning to you and good morning to the viewers as well. Thank you very much. Yes, my name is Priscilla Reddy and I work at the Human Sciences Research Council. We conducted the survey around April, from about the 11th of April to May 2020. It feels like a decade ago, I have to say. And at the time, the questions we asked were relevant to what was going on at the time. And around August, we found that we had about, the numbers have literally doubled. The numbers of healthcare workers that are infected now have doubled. Yeah. And yes, their health and well-being was in question. The healthcare workers were feeling afraid, they were feeling depressed, they were feeling sad, and they were extremely concerned about their families. The good news now is that we did the survey a while ago. We have another survey planned for the middle of January, where we'll be asking healthcare workers other questions that are relevant to their work situation now.
Talk to us about the methodology of the next survey and how different it will be, especially with regards to the various questions that you will be asking this time round.
The methodology would be the same, which is an online data-free survey that worked for us. We had over 7,600 healthcare workers' data that we were able to analyze constructively. So we would use the same method. But I think the big issue now, and as you on your news channel have been talking about, is the issue of vaccines. I think people are very concerned about when we're going to get the vaccine, how we're going to get the vaccine, and how we're going to pay for the vaccine. But from a healthcare worker's perspective and the general community's perspective is, once we got those vaccines, how do we implement a vaccine initiation program? Right. So we will be asking a lot of questions about vaccine preparedness, who exactly is going to do this, how they're going to do it. And it's not just about the healthcare workers' behavior in administering the vaccine, it's also the logistics. So we would be adding questions on logistics as well. And obviously the general public's attitude to receiving the vaccine and to accepting the vaccine. A vaccine is only as good as us healthcare workers getting it into the arms of South Africans.
Correct.
Fortunately, abroad, Reddy, we've seen a positive response to vaccines.
Sorry to cut you off. I mean, a lot of people, I want to talk a bit more about that. A lot of people are resting their hopes on a vaccine. Far too many believe it's a cure. It's not. We keep saying that we need to follow all these protocols before science comes through for us, isn't it?
Yes. Yeah. I think, whether we have an alternative strain or the same original COVID-19, whatever virus we're talking about, ultimately it's about human behavior. Yeah. And the behavior of the public is actually going to be the deciding factor on how this virus spreads. This virus can only spread if we do not engage in the behaviors that we should, namely masking, social distancing, restriction of numbers. I think that's what the president was trying to say last night. He's trying to put in a circuit breaker of behaviors so that we lower the numbers. And if we lower the numbers, we can relieve healthcare workers on the wards in the hospital. And we need their energies and their strengths to prepare for the vaccine program. Right. So I, from the HSRC's perspective, would urge people to please try their best, as difficult as it is, to engage in preventive behaviors, because these behaviors work.
You know, we were just talking about the uncertainty earlier on, and I wonder how much it's impacting healthcare workers. I was listening to America's top doc, Anthony Fauci, and he was talking about between 70 and 85% for herd immunity for COVID-19. And if COVID has taught us anything, it's that, and Fauci agreed, is that we need to show some humility with this virus because we just don't know the exact number for sure. How much does that play into the mental well-being of healthcare workers going forward, this uncertainty?
Well, yeah, I do agree with what you're saying about we need to, humble ourselves in the presence of this vaccine and the creation of uncertainty. But even in the context of uncertainty, I do think if we learn from HIV and AIDS, if we learn from TB, and if we learn from the Spanish flu, once people take action and people decide that this is serious, people are dying, people are getting infected, we can make a difference. I do think there's hope in the context of uncertainty, and it's all about behavior. I do realize that this virus is very transmissible at the moment, and the strain we have is transmissible. But again, the appeal is if you want to help health workers, if you want the economy to go back to normal, it's every single South African that has to engage in preventive behavior.
Yeah.
And it's for a short, as far as we understand it now, it's for a short time. What we do now for the next 2 weeks can diminish the amount of uncertainty and help us put resources into much areas.
You know, I spoke about this at the top of the program, about my interactions with a family member and the uncertainty and the pain and the strain that she goes through. She's a medical health worker, and she'll be treating a patient one day, the next day, the patient is not there anymore. The patient has died. We all want people to see the best version of ourselves, which sometimes means not talking about certain problems we might be going through, certain battles that we are fighting within ourselves. How important is it to have a strong support system, be it friends, be it family, even mental health professionals within your inner circle, so that you can vent and not let things build up?
Yeah, well, in the first survey, we definitely asked about what kind of support they would need and what kind of support health workers already had. And unfortunately, there was very limited support given the time. I mean, this was in April this year, so it was early days, and there was very little support. But the results from that survey definitely demonstrated a need to improve social support, be it in the family or the community, or actual mental health support. And one of the things that health workers said, both qualitatively and quantitatively, the way the public can support them is for engaging in preventive behaviors so the wards don't get overloaded. Unfortunately, we are in a situation where we're reading about hospitals and wards being overloaded, and I do think it's going to impact on our healthcare workers for a long time. So we're going to have to look at innovative and creative support programs. And I'm glad that many health workers can turn to their families. And all of us have lost people to COVID, so we know what it feels like. We know what that alienating type funeral feels like. So again, my appeal is to South Africans to please try to abide by the regulations. And in fact, there shouldn't be regulations, there should be each of us taking responsibility for ourselves and trying to protect ourselves, our friends, our neighbors, and our families. That is by masking, social distancing, and all the other the behaviors that the president outlined last night.
Yeah, indeed, we need the best warriors to help us fight this pandemic, and that's our frontline healthcare workers. If we lose them, then it's harder to fight this battle. It's almost impossible to fight this battle. You know, you touched on this, Professor, earlier on with regards to the vaccine. You know, on one hand, you have the vaccine production. That's one. The next thing you have to do is distribute the vaccine. You were talking about getting that into the arms of people. But you have to consider also whether people are comfortable with getting vaccinated. Talk to us about your survey going forward. That is probably one of the questions you might be asking in your survey. And is the latter a major concern for you, whether people will get vaccinated or not?
Well, you know, if we look, I'm working with some colleagues overseas on looking at vaccine preparedness and vaccine accepting behavior. And I think particularly in the United States, people were the scientists or the researchers like myself were concerned that major numbers of people are skeptical about the virus, and of course about the vaccine, and of course there are fake news makers there who are punting incorrect information about how the vaccines are tested, on who they tested and their outcomes. But fortunately for South Africa, we can learn from other countries who have started vaccinating their populations and to look at what might, you know, there were some side effects. With the measles vaccine, there are side effects. With all medication, there are some side effects. But if we look at the cost and the benefit, certainly taking the vaccine, looking at the scientific data is a major benefit. So yes, there will be the skeptics, and hopefully they will be in very small proportion. And we at the HSRC will probably be doing a Wave 3 survey among South Africans, and we will be asking questions on people's attitudes to vaccines. But generally, from my experience and from the data, it's a very small percentage of people who do reject vaccines.
They say the only thing that's spreading faster.
At the end of the day, you've got to go by what the science is saying.
Correct.
Science is trying to be ahead of its time.
They say, I was just saying, they say the only thing that spreads faster than the virus is misinformation. It's something that we need to deal with. Infodemic, one would call it. People think that they're trying to help when they put out these messages, you know, on social media. But what are they doing? They're creating another layer of uncertainty, which is compounding the situation. Great perspective. Yes, carry on.
I have no doubt that our Department of Health and other departments will put out good quality, factual health education material on vaccines as we move ahead. As I said, because the objective would be to get effective vaccines into arms.
Right. And you can trust news channels like the SABC in order to bring you the facts. We bring you the facts. It is up to you to decide what to do with those facts. Professor Priscilla Reddy, the lead researcher from the Human Science Research Council, we thank you very much for your perspective. Very, very important indeed. Good health to you and your family. Be well.
Thank you. Same to you and the viewers.